What if I've had surgery, in this case, spinal fusion already? Can you help me, or is it basically too late?
That's a really great question. We can absolutely help. Something that I like to bring to attention when we get asked those type of questions is you still want to consider what led to this situation to begin with. Why did you need this spinal fusion? And usually there is an underlying root cause that led to this procedure. And if that's not addressed, then your body's going to continue to compensate, and that part of the spine that's now fused that can't move, the work and the demand that was taking is now going to go somewhere else. It'll go higher, it'll go lower. Your body's still going to try to figure a workaround if you're not getting to the root of the problem, which was a dysfunction in your body to begin with. And, if specifically a spinal fusion, we're not going to go in and make you move things that can't be moved, but we can reduce how much compensation there is around that, and then limit how much, if there's still pain. Sometimes people still have pain after surgery, so we can limit that. We can increase your function so that you can still do the things you want to do, even if you have this procedure that was already done. So yes, we can absolutely still help with those situations.
Certainly identifying the original causes to what led to the surgery in the first place is extremely important. And I often like to describe surgery as controlled trauma. Your body's going under controlled trauma to repair, but your body will still perceive that as an injury. So it's going to compensate around that injury that happened. So, we often see this in any surgery, but also to knee replacements or hip replacements as you get older. Oftentimes what we find in the appointment is that the reason why they had that hip replacement, that underlying cause, is still there, like Elisa was saying, that whether they offload onto that replaced hip. So if that hip is not going to degenerate, what's next in line to break down, so to speak? So certainly improving the whole body in terms of how it functions and getting rid of those underlying can not only help with your recovery, but prevent anything else down the road as well.
I definitely agree. Even if you've had surgery, especially something like a fusion, it isn't too late to get in. In fact, I usually tell people it's probably better to get in now if you weren't able to get in before. A big part of our therapy is trying to identify an underlying dysfunction. A lot of times that can be, musculoskeletal prior to people having surgery. But now that you have a couple of bones, one or two vertebrae or three or four vertebrae that are now fused, that is now a new dysfunction because those vertebrae are not going to move the way they were designed. And, it's not a bad thing. It's just something that you need to be aware of, that's not going to work, and you're probably not going to get the hardware taken out, and we can't remove the hardware. But what you can recognize is that now that you have one section that is a true dysfunction, like Elisa said, your body is still going to try to find a way to move. So what we want to do is limit how much compensation there is, because what tends to happen is you will start to compensate around that. And then a couple years later, you're needing another fusion of the vertebrae above it or below it, or a different section of the spine. So you want to try to avoid that as much as possible before you end up getting the whole thing fused, or, leads to a different joint compensating even more. So I usually, whenever I get those phone calls from people, whether they've had a spine fusion or, a hip replacement or anything else that's been kind of pinned and put together, that is now your dysfunction, and you want to limit compensation as much as possible so that you limit pain, you don't have anything else pop up in the future.
Absolutely. Those are all really good points. And I think the only things I would add to that is one, that anybody who, first, let's say that, Egoscue, we look at getting the body to work in its design function, which means that if you have the fusion, you've got a lot to work with still. And like you guys were talking about, usually that's the area that got fused that was being asked to move in a way. So fusion thinks stability. You're creating artificially some stability there because this area was just getting beat up. So if it's a lumbar fusion, let's say, then what were the hips doing underneath? they probably weren't moving as well as they should. So all that pressure was going up, and mobility had to occur somewhere else, which is usually that lumbar spine and or the thoracic spine. Let's say it's a cervical fusion, and that upper back is just locked and the shoulders around it, and the head is forward. And so then they fuse that, but nothing else, like you guys have talked about, has changed. So the pressure's still there, and then we just go down the chain, or we go up the chain in terms of the spine, and we wait for those pieces to wear out, because now we've taken away movement there. So from that side, then it's always work with what the body will give us and go from there. And that's just the way it is. So if someone has a fusion, not a really big deal in that sense. But usually what I'll tell people in the beginning is that, your first objective is to prevent the next surgery by reminding your body, here's how it's supposed to work. And I don't know if you guys have had the same case, but I think one of the worst cases I've seen of fusions was a lady who had some scoliosis. She had her lumbar fused, and then she had so she had, let's say, I believe it was L1 through 4, 1 through 5 fused, and then they fused like T10 through T2, and then they had to fuse the in between. It was just like the whole thing was just ended up being fused. And she was like, if I could go back in time, like I would. But I think the other piece of that too is, because you've had a fusion does not mean that you have to live in pain. And I think that's the point you guys made. I just want to make sure that we emphasize that too. The fusion does not equal the pain. It's the improper use of your body, and why maybe that area or around that area is still not working properly, because like you guys have talked about, the mechanisms around that or up above or below are still at work currently.